Kim Brawley, and I'm a pediatric dietitian at Seattle Children's Hospital in our IBD center. I've been working on the SCD diet in research form for the last 4 years, and it has been a joy to do. And we are very excited to bring to you kind of the first clinical training that we have in the form of a study, the PRODUCE study. So thank you all for joining us. Today's presenters will be myself, Kaylee Nguyen, nurse practitioner at Lucille Packard Children's Hospitals, who has abundant history and clinical practice using the SCD. Giselle Woodward and Sherry Pilley are our SCD parent partners who have been an active role in making this study happen, and they know the SCD well. And lastly, Catalina Baron-Blum is an SCD patient who has been on the SCD for 6 years, and she's been a tremendous resource as well.
So this book that talks about the SCD is called Breaking the Vicious Cycle, and how carbohydrates play a role in the vicious cycle is depicted here. You can see at the center, it's proposed that there's small intestinal mucosal injury in inflammatory bowel disease, which then leads to carbohydrate malabsorption down below. And because you have poor absorption and breakdown of the carbohydrates, those carbohydrates go on to the latter parts of the small intestines and large intestines to feed the bacteria, causing bacterial overgrowth. And that bacterial fermentation causes increase in byproducts such as nitrogen and methane and hydrogen and carbon dioxide, which then causes more bacteria and more mucosal injury. And at the same time, when you don't absorb the carbohydrates well, it causes an osmotic effect and it draws water into the intestines, causing more chronic diarrhea. So when you eliminate complex carbohydrates or carbohydrates that are not well absorbed well, you break that cycle, you stop the feeding frenzy, you reduce bacterial overgrowth, reduce byproducts, reduce the diarrhea, and so on. And that's what they mean by breaking the vicious cycle. Next slide. So this is the basics of the SCD. Just what can you eat? Again, like all popular diets these days, it focuses on fresh, whole, unprocessed foods. And you'll hear the term legal, and throughout the rest of the presentation, you'll hear the terms legal and illegal, which is the lingo that was introduced in the book and then adopted in the SCD community on and offline. So legal means stuff that can be enjoyed, and illegal means stuff that you can't, that you should avoid. So you can have all fresh meats, fish and shellfish, both fresh and frozen, but you can't have the packaged and deli and preserved meats, which have a lot of illegal ingredients. You can have most vegetables except for the starchy kinds like potatoes and corn, and the mucilaginous ones such as taro and okra or cactus. You can have all the fruits except for green bananas, plantains, and young coconut. Of course, when green bananas and young coconut become ripe, all those starches are metabolized or changed into sugar. So you can have the yellow bananas with spots and the ripened coconut that's brown. And you can have all fats and oils, including butter, that we kind of want to limit the highly processed oils like canola and corn. You can have cheeses that are aged for more than 30 days, but not the soft, unaged cheeses like cream cheese and cottage cheese. Brie is one example of an aged cheese that's not hard, so that is legal on the SCD. The SCD really encourages homemade lactose-free yogurt. It does allow for lactose-free milk in the latter, more advanced stages, and also homemade nut milk that doesn't have any stabilizers or thickeners. And it does not allow for regular milk or commercial yogurts because almost all of those contain lactose. Nuts and seeds are allowed, but the flavored, sugared, or packaged nuts and seeds are not because they have a lot of anti-caking agents to keep it from sticking. Honey is the single source of sweetener aside from fruit. And you really can't have any other things like maple syrup, etc., except for the purpose of this study in the modified arm, maple syrup is allowed. And then legumes such as lentils and beans, as long as it's soaked for 12 to 24 hours to remove some of those extra starches, are allowed. And then it does not allow any grains whatsoever, even the gluten-free and ancient grains. So there is a lot to eat, and you can definitely have a well-balanced diet that meets nutritional needs. Go ahead, next slide, Smile. In the modified arm of the SED, we have included some additional foods. The study team wanted to add these foods as a way to just compare the differences in response. What if we added a few foods that are not traditionally considered legal? How would that change a patient's response? And these particular foods were chosen because in our collective experiences between the parents and the clinicians, these foods have been well tolerated by patients on the SED as they began to kind of include other foods later on. And these foods would add variety and options for many recipes for the patient, and it might help them stay on it longer. So it includes, as far as grains, oats, organic brown and white rice, and cocoa, and sweet potatoes, excuse me. And then others include maple syrup and cocoa. For the research purposes, patients would be required to consume a minimum of 3 servings of any of those grain items or the combination of them each week, because we need to be able to compare the different arms, right? We would also want to limit the patients to a maximum of 6 servings of each of those grain items or combination of items, because we need to keep them on a limited carbohydrate diet, and they can't just be eating sweet potatoes and rice every day at every meal all the time. And then as far as maple syrup and cocoa, we also presented a minimum of 2 tablespoons a week and a maximum of half a cup a week for each of those items. We'll go back to Kim now.
Tricks and treats of the SCD and modified SCD. We've compiled kind of our experiences and what we've found to be helpful both in clinic and at home. And we'll start with some meal options with breakfast. So kind of example, SED meals could look like a smoothie. We want this to be high calorie, and we'll get into weight loss soon. But something like the SED yogurt made from full fat milk, even heavy cream, or coconut milk from a can, or avocado with some sort of added protein like a nut butter or egg whites, as well as a fruit. And you can get creative. You could substitute traditional crepes with coconut flour crepes and add your favorite toppings. Another option could be an egg omelet with veggies, aged cheese, salsa avocado, or even SCD legal bacon or sausage. Many kids love homemade SCD sausage made from either turkey, pork, beef, whatever they prefer. And another popular favorite is grainless granola made from nuts and seeds. Coconut flakes can be added, mixed with various dried fruits, olive oil, and honey, and then baked in the oven. It makes for a delicious high-calorie snack and breakfast. Next slide. Examples of lunch. The easiest is definitely leftovers from dinner, but some kids really like to be simple for lunch with like a cheese and meat platter, some sort of sandwich if they can find a bread that they like made from almond, coconut, pecan flour, filled with tuna or peanut butter and jelly or egg salad. You could also do a standalone item like cauliflower rice stir fry, which is pretty easy to cook up. And you can do like something like the picture shows, an open face lettuce wrap or bowl with kind of Thai Asian dressing and beef or chicken or whatever meat you have inside. Next slide. And then dinner, I truly feel is the easiest and the most consistent with what we would typically think. A lot of this is thinking outside of the box, which we do as dietitians, but how can we make it kid-friendly as well as the trick? Kids, some of them like ribeye steak or salmon with cauliflower puree to make it similar to mashed potato consistency with butter, or SCD cream cheese with a grilled veggie. Something like in the third picture, your choice of meat sauce or lentil sauce over zoodles or spaghetti squash. Pesto chicken with steamed and grilled veggies. Hamburger wrapped in lettuce with all the toppings aside from a bun. Or soups. Soups, I feel like, are one of the easiest options to have for meals that are SCD compliant. So squash, lentils, bean, Italian wedding can all work on the SCD. Next slide. Prepackaged foods on the SCD are both awesome at making life easier and convenient, but we also have to be careful with these. So I love to say it's possible to be a junk food SCD follower, just like it's possible to be a junk food vegan or vegetarian.
I'm going to talk a little about SCD yogurt. Some of you might know that I have been cooking the SCD for my husband with Crohn's disease for about 13 years, and have become an expert on the SCD, at least at our hospital at LPCH and the surrounding community. And I make yogurt, oh gosh, probably a gallon of yogurt every week, probably at the beginning of the diet. So it's very, very easy. It sounds very tedious at first, but it is not. The yogurt is a very important part of the SCD because it's versatile, and you can incorporate it into many recipes, and it's also the best sorts of probiotics on the diet. Because remember that we're breaking the vicious cycle, starving out the bad bacteria, and hopefully wanting to repopulating with beneficial bacteria.
So the stages of the produce or of the SCD get a lot of talk. And for those of you that have done some education and research on the SCD, I would say that this is one of the topics that can be the most confusing and inconsistent. So next slide. For those that are maybe not as familiar with the diet, the theory behind the stages, there are a couple, and one of them is that the stages may cause potentially beneficial changes in the fecal microbiome. They also may help with symptom management, kind of moving from more easily to digest foods to more advanced foods. The stages have evolved over time based on the SCD community's experience and varied experiences. Up until this point, there's no clear evidence to suggest these are necessary, but there's strong belief in the SCD community. Therefore, we are including the stages, or our version of the stages, as part of the study design. And we will talk about kind of the variation that we've used for it in the next slide. So our stage 1, we're calling the beginner's SCD so that it's not confused with all the various other stage 1s out there. And Elaine Gottschall does, in her book, Breaking the Vicious Cycle, does talk about kind of staging foods or kind of an intro diet, foods that are easier to digest, but she does not really expand past that on a systematic way of introducing these foods back into the diet. So I know, at least you guys probably have had this experience as well. Families will come into clinic and they'll still be on the intro diet for weeks and weeks on end, waiting for symptoms to improve as the child is losing a lot of weight. So you'll see with our beginner's SCD, we've extrapolated the concepts from Elaine Gottschall and with the concept of these foods being the most easily to digest. You can see that we've included foods from each food group to ensure that the child can still have a nutritionally complete diet, including fats, oils, to help with the calories as well. On the bottom, you'll see that part of the modification for the easily digestible portion are that fruits and vegetables should be ripe, peeled, and cooked. They can be blended in a smoothie, which would make it more easy to digest. You don't have to necessarily cook the fruit and then put it in the smoothie, for example. But if they're eating it raw, it needs to be cooked. Ripe spotted bananas and avocado can be raw. Meats, eggs, poultry, fish can be cooked in any way except for deep fried at this point. And a key thing to note, and that's why it's in all caps, is that we want patients to move through the beginner's SCD within 2 to 3 days. So by day 3 on the beginner's SCD, they should be ready to transition to our next stage, which we've called the full SCD. So our stage 2 is titled the full SCD for the produce study, and everything that is legal on the SCD is legal at this point. So you can see the additions we've made for each food group, including condiments and other. And by this point, patients should stay on this stage for another 2 to 3 days at most. For the patients that are on the strict SCD arm, this will be their final stage for the the remaining weeks of this arm. For those that are going onto the modified and have been randomized into the modified SCD group, they will advance to our 3rd stage. You can see at the bottom here, fruits and vegetables can be given in all legal preparations, as well as meat, eggs, poultry, and fish can also be given in all legal preparations. Next slide. So here's our modified SCD again. For those that are on the modified arm, and all patients in the study will be on the modified arm at some point. A couple times they'll be on this arm. They will reach this stage by day 5 to 7. Kaylee did a great job of explaining kind of the foods that are on the modified, in addition to all of the legal SCD foods and the serving amounts that we would like for them to have each week. So I won't go into that. The main take home is this stage should be started by day 5 to 7. You need to tell families that, because if they look at other resources, they may say, oh, we need to stay on these stages until symptoms improve, and they may read about that, which is right. It's really important to say for weight and overall health, we really need them to reach this final stage by day 5 to 7.
So as Kim mentioned, weight monitoring is a really important part of standard of care for inflammatory bowel disease, and especially for the kids with IBD who are on dietary therapies. So the study criteria that we developed is that if a child loses 5% of their body weight at any time during the study, they would require active management. So that might mean more clinic visits to meet with the dietitian, additional weight checks, etc. And if the clinician feels that it's needed for from a health perspective, then they may recommend that the child be withdraw from the study. And then if a child loses 7.5% or more of their body weight during the study, then it's an automatic withdrawal.
B vitamins, as you saw, as we know, are found in a lot of the leafy green veggies and the legumes. So if you find that a kid just really isn't eating a lot of fruits and veggies and they're really protein and fat heavy, I would recommend doing a B vitamin. Iron is controversial in the SCD world. Elaine Gottschall, when she initially published her book, discouraged supplementing with iron as it can be more irritating on the GI tract. So for kids that are on the SCD, we've usually implemented this diet for kids with mild to moderate disease. So they are anemic, but not necessarily symptomatic. So we do not usually supplement with iron, but if they are having symptoms or they're significantly anemic, you're going to discuss that with their main GI provider and definitely supplement iron if it's indicated. Next slide. Vitamin D required its own slide. Just like it's popular in the medical world, it's popular in discussion here as well. At our clinics, as standard of care, we check a vitamin D at baseline. And then if a patient is deficient, we will begin supplementation based on our formulary or clinical judgment for that patient. And then we'll follow up with a follow-up vitamin D 25 hydroxy level within 3 to 6 months, usually, or based on kind of as needed, based on their baseline level, how deficient they were, their diet, if they're getting very much vitamin D, if they're outside or if it's winter. So we recommend that for all of your patients, you check a baseline vitamin D and then discuss with your physician if you think that provider, if supplementation is indicated and when to follow up on that.
Hi everyone, so my name is Catalina. I'm a 20-year-old college student and I have Crohn's disease and I've been on the diet for about 6 years. So I want to talk a little bit about how I present the diet to people either who are wanting to do it, who come to me for support, or even my friends who are asking about why I'm doing what I'm doing. So really, I try to motivate anyone who I talked to about the diet with a positive outlook. So making sure to acknowledge that there is a learning curve when it comes to it. So it's not kind of like a immediate, you can't really move into it immediately with ease, but it's a simple diet to follow, and it's a healthy diet to follow. And it's not really as difficult as it seems. So again, really focusing on what you can eat rather than what you can't eat. So when people ask me why or how I'm doing the diet, I don't necessarily say like, oh, I can't eat grains, I can't eat processed sugars. Rather, I say, so basically what I eat is simply cooked animal protein, vegetables, fruits, nuts, and aged cheeses. and that's pretty much it. And focusing it on it like that, I feel like gives patients and families a more positive outlook on the diet. And it's worth acknowledging that the world today is a lot more prepared to accommodate special diets. So whether that comes in the form of food allergies or paleo or gluten-free, I spend a lot of time walking into health food markets in different places, and the number of options that there are for tons and tons of diets, as well as how willing restaurants and other people are to accommodate special diets, has grown substantially in the past 5 years even.
Many patients who have inflammatory bowel disease also have irritable bowel syndrome and lactose intolerance. And in having those, they may want to avoid foods that worsen these symptoms. And lots of them use something called the low FODMAP diet, which is focused on foods that are low in fermentable illegal saccharides, disaccharides, monosaccharides, and polyols. And I get a lot of this in doing these consults because the patient is on the low FODMAP and now wants to start the SED, and they'd like to know if they can still maintain the low FODMAP on the SED. So you can see on the left-hand column, foods to avoid on the low FODMAP diet. There are a bunch of foods that you're supposed to avoid in the FODMAP, but the blue means that it's SED legal, and the red means that it's not. On the next column, foods that you can have on a low FODMAP diet, you can see that there are lots of foods in red that you can't have on the SED. So in order to have both a low FODMAP diet and an SED, you're only looking at the blue foods on the right-hand column. And although I included only a few examples, it does illustrate the point that low FODMAP is not the same as SED, and trying to combine the diet eliminates large food groups that might then lead to incomplete nutrition.